permanent members to the National Council of Provinces from Gauteng have been told that repairs to the fire damage at the facility are set to be completed by 2023. A fire swept through the facility in April 2021, causing parts of the hospital to shut down. The visit forms part of the NCOP's Provincial Week program, where members of parliament visit their respective provinces to conduct oversight. Earlier, the NCOP delegation visited the Chris Hani Baragwanath Hospital. Let's find out exactly what happened in that visit. We're joined by senior reporter Tumaole Mohlauli. Tumaole, I imagine this visit couldn't have come at a better time for some of the staff and personnel at a hospital like Chris Hani that have been complaining and protesting even about the lack of staffing and the threat, of course, to lose some of the staff members that are much needed. And today they had the opportunity to show members of parliament firsthand what exactly it is that they're going through there.
Yes, indeed, Kathy, and quite some interesting remarks as members of Parliament got to hear and see firsthand some of the conditions that these health workers are facing on a daily basis. And what is important also is the fact that they got to say themselves, the members of the National Council of Provinces, that looking around, it looks like the COVID-19 pandemic and this particular wave is still not letting up, and the hospital infrastructure in terms of course, human resources is buckling. They're saying that they've heard firsthand how many healthcare workers have simply walked out, even those who are in the internship phase of their training before they formally graduate to become official doctors. But what's holding down the fort is, of course, the nurses. They have been given, some nice praise to say that they have really played a key role. But, the impact of having to deal with this at the front lines, seeing people die, seeing, people suffer and wondering if they themselves are putting themselves as well as their families at risk was something that was mentioned. So this oversight visit deals with a lot of things. And now we are at the Maxeke hospital here in Johannesburg, and the fire that gutted this particular facility is also being dealt with extensively by the CEO of the facility and other medical professionals who work here. They have for the first time spoken out about what actually happened leading up to the fire and how they managed to evacuate the facility without any lives being lost. But they're also dealing, Kathy, with the aftermath of that fire. The figures that are being crunched are quite extraordinary. We're looking at about 780 million. Now, this is the initial figure that was put out. That has since gone up quite extensively because as the repairs happen, there still is some additions and there have been some delays. COVID-19 hasn't helped at all. So these are some of the things that we are finding out from this briefing.
When we look at the difficulties in as far as the repair and the full reopening of the Maxeke Academic Hospital is concerned, of course there's the issue of corruption around why it is that it has taken so long, and certainly a suggestion that part of the delays are benefiting people who are seeking to basically make some money out of this process.
Make quite a lot of money out of this process is what have been some findings, including the SIU report, Special Investigations Unit, looking at how, initial invoices and certain companies linked to those who are alleged to have been behind a very sophisticated syndicate, and some of them are very high-ranking members of the Gauteng Department of Health itself, especially within the finance department and acquisitions. And that report certainly painting a grim picture about how these finances and in terms of invoicing, they were then cooked up. And this goes against the PFMA, the financial management instrument that guides and basically manages how those those who are tasked with managing state resources and funds are meant to undertake their duties. And Kathy, when you listen to how the SIU report, or when you see the SIU report and how these particular findings that it has come to paint a picture of some really underhanded and unfortunate, when you look at the context of COVID-19, manipulation of tender processes and the financial instruments that were meant to assist. And when you look at how these prices have now ballooned, it certainly begs the question whether these public funds are being used for the right purposes, and whether the lives of those they are meant to benefit are being prioritized.
We can only hope that Parliament and members of Parliament are going to do more about the issue beyond just coming for this oversight visit and hearing perhaps firsthand about what has been taking place there. We'll leave it there with Tumaole Mohlauli.